All right, guys. So for the arms, I like Lipo Lab and hyaluronic acid. I do these two together. This is the cocktail that I like for my arms. So if you're trying to reduce, so what the Lipo Lab is going to do is it's going to break down any fat that your client has on their arms. And what the hyaluronic acid is going to do is build collagen so that it can tighten their arms. Now, you don't want for the arms to get flabby once you're done. So that's why you're going to have to use a compression garment. And that's also why I recommend adding the hyaluronic acid, because the hyaluronic acid is going to produce collagen. Okay. So those are the two. Based off the client's arm size will determine how much cocktail that I would use. So for a person this size, she has smaller arms. So I probably will only do about 10 mLs per arm. I would do about 10 mLs per arm. Now, if she had larger arms, I would do anywhere from 30 to 40 mLs per arm. Okay. And so usually what I do is I only do 10 mLs of hyaluronic acid, no matter what size. So if I'm doing 40 mLs, I'll do 30 of LipoLab, and then I'll do 10 of hyaluronic acid. And you can mix them together or you can do them separately. If you do them separately, it is going to take you a little longer, but you can mix them together because these are considered cosmetic topical serums, TOPICAL. Therefore, you can mix them both because they're oil-based. Now, what I would do is when I'm doing my clients, I like for my clients to lay down on their back. So can you go ahead and lay on your back for me? And you want to measure first, so make sure that you measure her arms first. Always try to measure in the middle where the fatty part is. One of the other things that you can do as well is you can add your red light while you're doing the service on the client. This is going to help the serums absorb better and faster. You cannot make noise while I'm teaching. All right. So I usually have my client kind of lift their arms up so that I can see this part. And you want to always make sure that you put most of the serum by the armpit to activate the lymph nodes. So, and you can dry brush before you do this as well. You guys know that I love using an eyeliner pencil because it just works better. So if I'm doing 40 mLs on this arm, I would do 40 boxes. But for her size, I'm only going to do 10. So I'll do 2 fingers away from her armpit, and then I'll start my boxes. You always want to make sure that you do it in the fatty areas. So wherever she has the most fat pocket, that's where you want to do your boxes. And it's 1 inch in every box. So you do 1 finger in between every box. So if you're doing 10 mLs, you would do 10 boxes. If you're doing 40 mLs, you would do 40 boxes. And you always want to make sure that you're doing it in a fatty part. Always try to get your client to move their arm back and forth. Take breaks so that their arm doesn't get tired. You can do it while they're sitting up. I just prefer for my clients to lay down just because I don't lose a lot of serum when they're laying down. You can do this with the manual pen or you can do this with the electric pen. Totally up to you. Once you're done doing your serum, you do have to wrap her arms. I recommend that you use like ace bandages, black wrap. You have to compress her arms, and she needs to keep that compression garment on for up to 8 hours. So once you're done doing the service on your client, you need to have her compress her arms for up to 8 hours, and then she needs to continue to wrap. You can do this service at least once a week for 3 to 4 sessions. So usually clients see their results that they're looking for within 3 to 4 sessions. Now, I always get the question of, can you do body contouring services with fat dissolve? You guys know that you can't get it wet. So if you're doing anything, before you need to do it before you do the fat dissolve. So you would do the contouring services first, you would do this second, and then you would wrap her compression garment on so she can keep it on for up to 8 hours. She cannot get this area wet for 24 hours. So for 24 hours, she cannot get her arms wet. When you are doing your electric pen, please make sure, and I recommend 0.5 for arms, just so that it doesn't take it that long. Whenever you're doing electric pen, I recommend 0.5 ampoules for the electric pen, but you also want to make sure that you keep it downward. Keep your pen downward, and you're going to rotate it. I like to do 10 times, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then rub. So once I push it in, try to keep that down. A lot of times you guys tell me that you lose a lot of serum with the electric pen. It's just the way the pen is, to be honest. You may lose some serum. It's a topical serum. Just rub it in. Just rub it in and you'll be perfectly fine. What questions do you guys have? So she can get this done once a week. 3 to 4 sessions is recommended depending on the size of the client's arm. Aftercare is she cannot get this area wet for 24 hours. She needs to keep it compressed. I recommend that you guys get them to compress their arms anywhere from 6 to 8 hours for the rest of the month. So when they're not getting the services done, they need to be getting their they need to be wearing their compression garments. They can even wear the compression garments that people wear for arm lipo. If you want to do body contouring services before this service, you absolutely positively can. You just need to make sure you don't do it afterwards, because then you are getting the serum wet, the area wet, and you can't get this area wet. As far as who can get the service and who cannot get the service, you guys know anytime you're dealing with serum, if the client has like heart disease, thyroid, any of those things, you have to get them to get their doctors to sign off. You just don't know how the serum is going to react with the medicine that they're taking. Nobody that's breastfeeding should be getting this service. Nobody that's pregnant should be getting this service. On an average, another question I always get is how much to charge. Well, if you're using 10 mLs per arm, that's just one bottle of LipoLab and one bottle of hyaluronic acid, which will probably cost you about $30. So you're spending about $30 in serum. Of course, for 4 sessions, I would say nothing less than $750 for 3 to 4 sessions. Because you're going to spend about 30, 60. You're going to spend about maybe $100 in just serum. So if you do about $750, you're profiting about $650. So I would say 3 sessions. So you'll make about $150, $300, $450. You make about $175 per session, which is what you want, about $175 per session. Any questions? And if you use the red light, it's just going to speed up the process. That's it. Red light helps produce collagen, so it's not going to do anything else. You can get ace bandages from Amazon, or like I said, you can just do the plastic wrap, but you need her to compress. Ace bandages just work better. All right, guys. So the replay will be available within 48 hours. If you guys have any questions, just jump on the app and I can answer any questions that you may have. Once again, I use a combination of LipoLab and hyaluronic acid. LipoLab is going to be the fat dissolve. Hyaluronic acid is going to be to tighten the skin. So once you break the fat cells down, the skin doesn't get flabby. The compression is going to help also with the arms not being flabby. All right, guys, if y'all have any questions, just let me know. And I hope you guys enjoy the rest of your Thursday.